Total number of unique patient tests, 14,661. Number of repeated samples, 2,276. The number of private sector tests completed week ending 7th of August 2020, 2,458, with a total number of public and private sector tests now standing at 19,395. Our total number of positives are now at 650, with 21 additional cases between 4 p.m. yesterday and 8 a.m. this morning. The number of deaths remain at 12. The number of discharges remain at 140. In terms of our hospitals, we now have 126 patients at hospitals spread between Cora and the Couva facility, 40 persons at the Cora hospital, and at the Couva facility there are 86 individuals. One person is in the high dependency unit, and there are 3 persons at the ICU. As you have noted, we have started to step down individuals who are positive at various facilities. We have added the UE Canada Hall yesterday as another facility that we can utilize for that purpose. So we now have 81 persons at that facility as of yesterday afternoon, 19 persons at this Brooklyn facility, 14 persons at Tacarigua. At the UE Davie campus we have 60, at Balandra 31, giving us a total of 237, inclusive of 6 persons who are healthcare workers are now en route to the Napa facility, which is now being used as a step-down facility for healthcare workers. In terms of our quarantine facilities, we have the Paria Hotel, which has 92 persons, the Cascadia Hotel with 36, the Regent Star has 18, Chancellor Hotel 21, and the Home of Football 28. Just to give a few updates, some related to the last press conference. So first of all, yesterday a non-crisis meeting was held with representatives of the TTRNA, CEOs of the RHAs, and chaired by the Permanent Secretary of the Ministry of Health to discuss, amongst other things, testing, quarantine, and PPE for healthcare workers. This meeting was called by the PS Ministry of Health on the instruction of the Honorable Minister of Health. There's no shortage, we just want to reiterate, there's no shortage of PPE. The meeting was very cordial, and I think we came to some conclusions. We'll have another follow-up non-crisis meeting in short order to follow on those discussions that started yesterday. With respect to 2 questions that were raised on Monday's press conference, just to clarify, I think I was asked the number of healthcare workers with COVID-19 at present. So just to say that we have 8 healthcare workers who tested positive during phase 2. In terms of the number of ventilators that we have, so we have a total number of 143 ventilators distributed amongst the RHAs. 70 ventilators are dedicated for the COVID-19 response. We expect to get later on this week 11 further ventilators to be added to the list to take us up to 81. By way of our staffing that we alluded to, in terms of the doctors and nurses that were coming on to help with contact tracing and swabbing at the CMOH offices spread across the country, we expect to get 24 physicians and 48 nurses added to our fleet. Hopefully the contracts already at the ministry awaiting the signature of the Permanent Secretary, which will be done today, and persons should assume duty by latest 24th of August and be assigned to the necessary CMOH offices. Ms. Alcantara, that's my clinical update for this morning.
Thank you very much for that clarification, CMO. And now Dr. Nandram will remind us about the importance of the new normal public health measures.
Dr. Roshan Parashram, Chief Medical Officer, Ms. Alcantara, COPCOM, and members of the media and the viewing public. May we have the slide, please? So, what I'd like to discuss today are the public health measures that we need to take to protect all of us. The new normal, as the Ministry of Health has been putting out there, are the new patterns of behavior, the new public health measures that we all must adopt to keep ourselves and our loved ones safe. And I'd just like to go through them in a bit more detail. So one of the most important things that we can do is to wear a mask. I know it's been said a lot of times, but sometimes we observe persons that may not be wearing the mask correctly, and I'd like to speak a little bit about that. A mask should cover your nose and your mouth, not just your mouth, but both of them, your nose and your mouth. The reason that this is so important is to ensure that any droplets that may, which is the way that COVID-19 is spread, do not get into proximity to another person. So wearing a mask over both the nose and the mouth will prevent this, and that is why it's so important to wear a mask properly. Another measure that's really important is keeping distance from others, and we speak about staying 6 feet or that any droplets that may, which is the way that COVID-19 is spread, staying 6 feet or 2 meters away from other people is so important, is because that's roughly the distance that droplets that can carry coronavirus can travel. So if you're 6 feet away from someone and they have coronavirus, it's unlikely that these droplets would get to you and then infect you. So social distancing is very, very important. This is particularly important in workplaces. Oftentimes we believe that because we know someone that they're safe, and we've seen time and time again where persons drop their guard in their office places and in their spaces of work. They come to work, they don't wear their masks, and then someone in the office gets COVID-19, and then the entire office has to go home. I cannot emphasize enough, masks are not just for when you're out in public. Please wear them when you're in your workplace, if you're coming within 6 feet of other persons. It's very, very important to maintain that level of protection so that you protect not only yourself but the people around you. Staying home when you're ill is one of those things that we assume should be, something that everyone should do. But for some reason or the other, some persons don't adhere to this guideline. And when this happens, they expose other people around them to contracting coronavirus. We've seen cases, and more than one case has been in the public domain, where persons who were ill did not adhere to the guidelines of staying home, and they traveled, put many other people, sometimes hundreds of people, at risk. This is particularly true if that person goes to a large workplace, and they can put their co-workers at risk. And we've seen this scenario in schools where it's at risk. So please, I encourage everyone, if you're ill, please stay home. Sanitizing our hands is something that people should do as a matter of routine. Please, soap and water, or if you can't get to soap and water, 70% hand sanitizer, alcohol-based sanitizer, will suffice. Our hands touch pretty much everything. They touch our phones, the surfaces we come into contact to, or food. Keeping our hands clean will reduce our risk to contracting coronavirus. Now, if you are symptomatic and you have a cough, you should be staying home. And even when you're home, it's very important to exercise cough etiquette. And by cough etiquette, I mean if you're coughing, please cough into a disposable tissue and then throw the tissue away, or cough into the crook of your elbow. This will help catch the droplets that may have coronavirus in them, and in so doing reduce the risk of transmitting coronavirus if in fact you do have that condition to anyone else. A lot of people touch their face as a matter of routine, and a lot of us do it unconsciously. We need to make a conscious effort to avoid touching our face, and the reason that this is important is because coronavirus is contracted through mucous membranes, meaning you can get coronavirus through your mouth, your nose, and even your eyes. So avoiding touching our face would help avoid having dirty hands that may have coronavirus come into close proximity to our mucous membranes, through which we can contract coronavirus. So please, I know a lot of people touch their face unconsciously. Please try to make an effort to not touch your face. And lastly, the last point I want to discuss is cleaning and sanitizing surfaces. These are hard surfaces that we routinely come into contact with. Doorknobs, counters, tabletops, and even our cell phones. Please, 70% alcohol-based hand sanitizer will do. In addition to that, bleach and water, 4 tablespoons to 1 quart of 4 tablespoons of bleach to 1 quart of water will also sanitize. And a lot of people don't sanitize their phones as often as they should. Please remember that in addition to sanitizing your hands, which come into contact with your phone routinely, our phones also touch our face quite frequently. So I would encourage everyone, please make it a habit to sanitize our phones. These are some of the new normal measures that all of us should institute. These should become habits that we do as a matter of routine now in our fight against COVID and in an effort to protect ourselves and our loved ones from COVID-19. Thank you so much, Ms. Alcantara. Back to you.
Thank you very much, Dr. Nandram. And as we all know, our SEA students are going into the examination room soon. And Dr. Othello will give some simple de-stressing strategies for these students.
Good morning, Dr. Parasuram, Ms. Alcantara, Dr. Nandram, persons logged in or viewing from distant places, and members of the media. As our country faces the many challenges that may be associated with limiting community spread of the disease while embracing the new normal, it is extremely important that we continue to pay attention to our mental health. Of particular relevance today, as Ms. Alcantara stated, is the fact that more than 19,000 of our precious children will sit the SEA exam tomorrow. And they will be sitting this exam under conditions that are very different from what they anticipated a mere 6 months ago, when they were not required to maintain physical distance from their peers and from their well-loved teachers. They weren't expected to wear masks or wash their hands frequently. And there weren't so many things happening in the environment that are so different and can be a source of a bit of stress. For many years, the importance of reducing stress and keeping as much anxiety as possible away from children at exam times has been spoken about. But this year is particularly important because so much has changed in the lives of these children. These children are old enough to be paying attention to current affairs, so they know what is happening. They've been hearing the news. They've been hearing about COVID-19 and about the new normal. They're probably hearing a lot about community spread and paying attention. So there's a lot happening that can make them anxious. And it's our responsibility as the adults in their lives to manage that so that they can sit their exams in a relaxed atmosphere and perform to the best of their abilities. So I will give a few tips to adults, to parents and caregivers first, and then I will speak a little bit to the children. So to the adults, it is very important that you maintain a normal routine for the children that you're responsible for, particularly children who are writing this exam. Over the next 24 hours, this is not the time to start doing things differently from what you're accustomed to doing. It's certainly not the time for last-minute cramming or for quizzing. You have to trust that these children have prepared for a long time, that they are ready, and that they will do their best. Give them your love and your support at this time. Avoid criticism, and please, please, please do not have conversations during the next 24 hours about your expectations with regard to children's exam results. This is not the time for that. Let them do their exams. Assure them that you are proud of them regardless of what the result is. If they start to talk about what school they want to pass for, remind them that it's not a matter of passing for a school. You will all pass. You will be placed in a school, and all is well. You will do okay. You will succeed in life. You will find your niche. You will do well at what you enjoy doing, and you will be okay. So you do not have to be anxious. Don't forget to talk to them about exam nerves, particularly if you know that you have a child who is prone to be a little bit anxious. Let them know that it is normal to feel a little bit nervous in situations where you have to perform, right? If you had to sing in a concert, if you had to be in front of a crowd, many of us feel a little bit nervous when we have to do these things. And for those of us who've done exams over the years, we know that we've been nervous from time to time when we've had exams. So let them know that that is perfectly normal, and that what is important is that the energy associated with that feeling is directed in the right way. In other words, you do the things that you can do to calm yourself and to continue your exam. You take a moment, you take a few deep breaths, you say a prayer, and you continue working. You trust that what you have learned over the past years is on the inside of you, and it will come out. So you just continue working and do your best. That is all that anyone can expect of a child, to do his or her best. Remember to let them know that you are already proud of them. You're proud of the hard work they've put in over this period of time. You're proud of their dedication and their consistency and their discipline. And even if you have a child who has not been the most disciplined child, that's all right. Still let them know that you are proud of them, so that they go into the exam feeling relaxed and feeling confident. And please make sure that they get a good night's sleep. As they face exam day, make sure that as they wake up tomorrow morning, they have a healthy breakfast. Don't try out new recipes. Please don't try to expose them to things that are not a part of their normal diet, because you don't want them feeling upset or nauseous in an exam. So give them something they're familiar and comfortable with, and ensure that they eat. Say a prayer with them before you leave the home, and pray in the way that you're accustomed praying. Don't suddenly have this long prayer that is different from what they're accustomed to, because that in and of itself can instill some anxiety in a child, because it may sound as though you are anxious and you're trying to do more than you usually do. So just pray with them in the way they are accustomed to praying. Remember the health protocols that have to be observed as you drop them off to school, and remind them about the health protocols that are expected of them. And above all, parents, please remain calm. If you remain calm, it is more than likely that your child will remain calm. After the exam, talk to your child about how he or she think that they handle the exam, but again, do that in a calm, non-judgmental manner. Reassure them that all is well. Even if they feel they didn't do as much or as well as they wanted to, reassure them that all is well. And even though you can't do the, fast food or mall lime that you would normally want to do because of the current situation, spend time with them doing things that you know they enjoy. You know your child. You know whether they like to do video games or watch Netflix shows or whatever. Do things that they enjoy with them, so that you make sure that they enjoy the afternoon after they come home from their exam in a way that maintains that calm. Remember that tomorrow is only one day, and after the exam is over, we still need to keep our children COVID safe. So to our children, once again, remember that you can talk to your parents and guardians and ask them questions about COVID-19. This can be scary for all of us, so tell a trusted adult how you're feeling if you're feeling anxious about the virus, and allow them to explain things to you if needed. Know that adults in the government and in the hospitals are doing everything that they can to keep us safe. And remember that there are things that you can do, and we spoke about them already. Wash your hands, avoid touching your face, wear your mask when you're leaving the house. So there are things that you can also do to help keep yourself and keep others safe. A few reminders to the adults. As the numbers of persons in self-quarantine, in state accommodation, or in the hospital rises, remember to do what you are supposed to be doing to keep yourself safe and to keep your loved ones safe. But also, if you are in quarantine or in one of these facilities, remember to maintain communication with your loved ones by email, social media, or telephone calls so that you do not feel isolated. Physical distancing does not have to mean social distancing, and it certainly does not have to mean isolation. Maintain that communication. It will help you to stay calm. Keep a daily routine of lifestyle activities that you enjoy doing and that you can do safely wherever you are. Use healthy coping skills that have worked for you in the past. Hobbies, relaxation exercises, and there's some really good apps that I've been told about that people say have been helping them quite nicely. And of course, your spiritual life. Remember to spend time praying and, practicing the tenets of your religion. Keep reminding yourself that also, although this experience can be difficult, you're doing this to protect your loved ones. So even though things have changed in a direction that many of us would have hoped would not have happened, we are here now, and we have to cope, we have to survive, and we have to come out at the end of this emotionally healthy. Thank you.
Thank you very much, Dr. Othello, for those very timely recommendations. And we move now into the question and answer segment. I invite media representatives to indicate your name and the media house that you represent before posing your question. In the interest of time, we ask for a maximum of 2 concise questions per media house. If time allows, we will facilitate additional questions. We begin with Loop TT.
Hi, good morning, everybody. Nika Pasanal here from Loop. This question is for the CMO, or maybe even you, Ms. Alcantara. At least the last 3 press releases from the ministry didn't specify the classifications of new COVID-19 cases. They usually state whether they were contacts or required investigation. Can you tell us the reason for this?
Yeah, so we're moving into, as you know, we're moving into a new phase of the epidemic. We have quite a large number of cases coming in, very large number of samples. The classification of contact versus awaiting epidemiological link is usually, when we send it out, based on what we find on the form itself in the initial release. We are using multiple sites as well. So we're now using Eastern RHA, North Central, so oftentimes the samples are going directly to those sites, so we don't have sight of the forms. So in that regard, we are trying to just give the number of new cases for now, and then when Dr. Hines comes on, we will break that down further into the number of contacts, the number of primary links, secondary links, and of course the ones that are local in origin. So that will be broken down more by way of presentation. So we have shifted a little bit in terms of the way we're presenting. We'll be presenting the new cases in total per day, and to give a better indication, when we actually get that data back to Dr. Hines' unit, he will analyze it, and then we will put some data out periodically as to how many of those would be contacts, how many of those would be non-linked local cases, and the other categories. Okay.
Thank you very much, CMO. And now we move to Tobago Channel 5.
Hi, good morning. Candice Jackson from Tobago Channel 5. My first question is in regards to the one case that was at the hotel that the Trinidad came across and infected a lot of people. Would that person face criminal charges now that you're saying that persons who break the regulations and so on, break quarantine, that they should be facing a fine? Would that person also be facing a fine for that? And what's also been happening with the TRHA facilities here in Tobago, because we're getting reports from persons that are at the facilities and are complaining, about uncomfortable conditions, construction noises related to the night and so on. Is it that the TRHA kind of relaxed themselves a little bit in making sure that the facilities were ready to go? Because of course, the last 5 months, Tobago did not have any cases. So just wondering if you could address those 2 questions.
Yeah, so the first question, I think I addressed it a little bit yesterday. So what we said is that in the initial phases, just after we went from sporadic to cluster phase, persons were being swabbed as community, if you recall, community surveillance. So those persons have normal viral illnesses, and they would have been told verbally to stay home, not necessarily been given a quarantine order. So a quarantine order is different from a physician saying to stay home. quarantine order actually goes along with the necessary is a legal instrument that allows for fines and other punitive measures to be placed on individuals if they break the quarantine. So for individuals who would have been told to stay at home, I mean, not adhering to that simple request by the physicians early on, we would not have been able to find those individuals. Now, there has been a procedural shift in the way we do swabbing now. So everyone that has a swab now, because of the stage that we are into community, we're asking the physicians to give you a quarantine order, so that if you breach that quarantine order, then of course you can be fined and you can be made to face some time in jail as well, based on the Quarantine Act. So at this point, if someone breaks the quarantine and they have a quarantine order, the TTPS will do the enforcement arm of it. In terms of the TRHA, the ministry has been continuously working with them to ensure it is a smaller ecosystem as it relates to the health system. They have one RHA there's one CMOH in Tobago. So we have been in constant contact with them. We are sending a two-man team across to Tobago very soon, maybe in the next coming days, to work alongside with them to ensure that their systems are back up and running in a way that we can all have a parallel system established. They have established a parallel system already, but of course, to increase that capacity, we are going across, and a report will be generated thereafter to the Honorable Minister.
Thank you. And we will now field questions from AZP News.
Hi, good morning. Priya Bihari, azpnews.com. CMO, I have a request from a national who is abroad and he wants to return, and he's asking in the context of sometimes the tests now that is done locally is taking a while to get back results. He wants to know if they can take a test where they are, and when they return, it would reduce their time in quarantine. They would take a PCR test and bring the results to the Ministry of Health. So he wants to know if you'll consider that now. Thank you.
Right. So I think it's two different things. So having a PCR test, we don't know when that test will be taken prior to coming into the country. So what we have done in Trinidad, other countries have asked for PCR tests prior to coming. We have decided to do the test when you get into Trinidad. So if you have a recent test, I would say within 48 hours of getting onto a flight, the only difference it will be in terms of our protocol when you get here is that the first swab may be, that test can be utilized in lieu of the first swab. Having that swab though, we will still have to have you in a 14-day quarantine, as well as do the final swab on day 12 or day 18, so that will continue. So it doesn't take away the quarantine period, but it will basically help us to assess their present status and of course put them in a lower risk category if they have a negative swab coming into the country.
Thank you, CMO. And I believe now we have questions from TTT.
Hi, good morning. Sonalala, TTT News. CMO, back in April, you would have indicated that posthumous testing was being conducted where unexplained deaths outside of the hospital setting. Can you say whether that is continuing and whether what are you seeing in terms of that? Are people showing up in this posthumous testing positive? Have you seen that?
Okay. Yeah, so I have reached out to the Director of Forensics at the Forensic Sciences Center almost a month ago, just to ensure that that is exactly what is happening. And they have indicated to me that the posthumous testing has continued from the start of the epidemic and continues onwards. So that testing has continued. They have not indicated to me that they have received a positive result thus far. So these are deaths that would occur outside of a hospital setting. We haven't had deaths coming out from the Forensic Sciences Center that have been deemed positive by the labs. So the testing continues and we have no positives as yet from that setting.
Okay, and now I think we're ready for I-95.5.
Good morning to everyone. Whitfield Turner from I-95.5. Dr. Ortello, I want to start with you with my first question. I know you spoke a lot about children who are doing SCA tomorrow and the timeliness of that. Could you speak now to those children who would be at home, most likely for the rest of the year, and not be physically going out to school, as to what steps they can now take to keep themselves together and mentally well. And my second question, I'm not sure whether the CMO or Dr. Nandram would take this one, but based on the contact tracing and the epidemiology thus far, are we yet in a position to state the source or sources of this current flare that we have in the country? And is this strain that we are seeing any different from the initial strain that we would have seen back in March to May of this year? Thank you.
Okay, Dr. Otello.
Okay, I would imagine that the news of school not opening would be a bit disappointing to many children. There may be those who are happy to be home a little longer, but I'm sure many of them are disappointed because they miss their friends, they miss their teachers, they miss their activities, they miss the after-school extracurricular activities that they were used to, whether it's swimming or basketball or whatever, right? So it's a change, and we have to use the tools that we have. We have to acknowledge the situation as it is and use the tools that we have. Okay, so as I've said before, use the resources. Talk to the adults in your family or whoever the close adults to you are about how you are feeling. Let them know that you're disappointed or you're anxious or you're upset. Even if you're angry, let them know so that they can talk to you and help you get through that. Right? And you may need to do it from time to time. Okay? It's important that the adults keep an eye on them so that they know if things are changing and if a child is not coping well, so that they can get the help for that child that child may need. But there are things that can prevent children from getting to the point where they actually need external intervention. Okay, things like keeping a normal schedule so that, okay, you don't have to go to school, but you have lessons that you can do. So you can do some schoolwork, you can do some reading. When virtual teaching begins, of course, that will help. But if there is no virtual teaching for now, fill your time with meaningful activities, including some academic activities, right? Parents, remember that hobbies are important, so make sure your children have things that they can do that they enjoy doing that are safe. Remember to monitor screen time and supervise online activity so that children aren't getting into dangerous online situations. That is very, very important. Parents, remember to keep reassuring them that it's okay to be uncomfortable with what is happening. What matters is how we manage that so that they don't feel isolated, they don't feel unduly worried, right? Remind them that the necessary steps are being taken to keep them safe. Remind them that help is available. Even if a child tests positive, remind them that this is not the end of the world. This is not a big disaster. Help is available. You will get the best care that can be provided to you. So you don't have to do anything different other than do what is necessary to protect yourself and trust that adults are doing what is necessary to protect you.
Thank you very much, Dr. Othello. And now Dr. Nandram will take the second question.
With regard to the contact tracing process, the contact tracing process is indeed complex, and with the number of cases that we've received and recently, we've taken the time to do an in-depth epi investigation into all of them. The thing about contact tracing is it's an iterative process. It's not done in a single day. It takes weeks. So at this point, the particular source and the linkages is still being worked out. With regard to the second part of that question, with regard to the strain, we are aware in the literature that several strains of COVID have been identified, and the Ministry of Health has received a research proposal from the University of the West Indies, with the chief investigator being Prof. Carrington, to look at precisely this. So the ethics committee has met, and we're working with Prof. Carrington and the UE team to get this going. So I hope that answers the question.
Okay, thank you, Doctor. And we will accept questions now from Guardian Media Limited.
Hello, morning, everyone. Rashad Khan, Guardian Media. So I have two quick questions this morning. The first one is to the CMO or Dr. Nandram, whichever one of you would be more comfortable answering the question. The first one is there or has there been a change to the way in which establishments or businesses or any organization where the sanitization process, where one of their employees may have tested positive for COVID-19? Because I received a number of calls with persons when there is someone that's tested positive and say, look, they're only shutting down that specific department and only those specific people sent to self-quarantine and sanitizing that area. And some persons have raised a bit of concern. And within this, is there now any public health benefit of any businesses or establishments that deal with members of the public informing by way of press release or something that an employee has tested positive so that the public can protect themselves? Now, the second question, also to you, Dr. Parasram. We've seen in the span of less than a month, over 400 cases of COVID-19. We've gone from sporadic to community spread in a relatively short space of time. We've seen the 800 well number being overwhelmed. There's too much calls. We're seeing a backlog of samples where persons are waiting not only days for results, but now weeks in some instances to get that result. Is it a safe assumption to say, or do you think that now we are seeing signs of our system starting to become overburdened? Thank you.
All right. So in terms of your organization, we would have noted as well certain areas being closed for sanitization. So we're talking about large buildings in some cases that you have multiple floors, you have multiple departments that don't really physically relate to each other. And oftentimes you have officers that go to a particular section of a building. They stay there for the entire day. They don't interact with other areas of the building. So what it relies upon is a proper history from the positive individual to determine how they would have moved within a space in a given period of time while they were ill. So every case is different. So based on their movements, then of course we will do sanitization. If someone, for instance, is a messenger that goes from one floor to the next and will deliver envelopes to every office in a building, of course we will say the entire building needs to be sanitized. If someone is working in one particular office, a senior manager stays in that office space for the entire day, is affected, we might only have to sanitize that particular space. So it really depends on what we find from the history of the cases, and there's no one size fits all in terms of sanitization and what is recommended. So it has to be based on the history of the presenting individual and their relationship to their co-workers and other sites. All right, so that's what it's based on. In terms of, I don't think we are at a point at this stage that we are overburdened, but it is a large capacity to deal with in a short period of time. And the measures, the public health measures that we have put in place, even at the early days, and what people have been saying all over the world is that we're trying to flatten the curve, is to ensure that the rapid increase in numbers does not occur to an extent that we become overwhelmed in the healthcare system. So we would have seen a bit of the curve going up, where you said 400 cases roughly in a space of a month. It is a sharp increase in number of cases, and it is putting additional stress on the system. But I think at this point it's safe to say that we have the capacity to cope with this number. However, as we have seen in other countries, if the public health measures that were instituted on Monday morning are not adhered to, we can see 400 becoming 800, 800 becoming 1600 in a very short space of time. And that is what we are trying to guard against. Because once you have that happening, there's no way any health system can cope. If you have exponential rises in numbers, we will have to change the way we see patients. And for now, we have even mild patients being hospitalized, which is a very good thing. In most parts of the world that are overrun by COVID, it is even difficult to get severe people to be seen in hospital. So for now, we continue to treat all COVID positive patients in hospital for a certain duration of time. We're able to step them down into other facilities and discharge them, and keeping with our protocol of 2 negatives. So We are keeping a very close eye on it, but we are really asking the population at large to abide by the public health guidelines. If we all work together, we can flatten the curve again, because the acute rise is really indicative of a sharp epidemiological rise based on exponential increase in numbers. So we need to blunt the curve now. We need to shorten that, otherwise we can look at overwhelming the systems. Okay?
Thank you, CMO. And now we move to Express.
Good morning.
Good morning.
Good morning, CMO, Dr. Nanram, everyone. CMO, two things, which is we have a report in our newsroom, or we have received a report rather, of a potential COVID patient who got tested at the Arima Hospital. This is going on a week, and this person is at home quarantined at her own will. However, she is suffering from symptoms. She's technically suffering now. She's not clear on what the actual ailment is because she's not yet gotten her results. So, I mean, you have been addressing the issue of delayed results and what people should do. But can we go again? What is delaying the receiving of these results? This person is in suspended animation, but also does not know what medication to take, what to do. She may or may not have COVID. The symptoms are similar. So can we just address that? Also, well, you just addressed it, having gone into the parallel health system. I was going to ask you about that. Other viral illnesses, we've touched on it before. I know that you may not be able to speak to exactly what local government is doing at this time, obviously, because we've just had an election, but your concerns at all? We are actually getting a lot of reports coming out of Central. People are being overwhelmed by mosquitoes, for instance. So can you tell us at all what the activity may be in terms of protecting the normal activities? We dredge, we keep these insect vectors at bay because we don't want parallel viral issues, obviously. Thank you.
Okay, so your first question, if I can get the name of the individual offline, we'll be happy to have that sample looked at. And you asked about two things. So there's two things. Persons are being swabbed and they have mild symptoms. If they are sent home at the time of swabbing, it means that they have very mild symptoms. Of course, over the course of a couple of days or more than that, your symptoms can change. So in terms of the normal clinical presentation, you can have worsening of your symptoms. And what we have advised before is that if persons continue to exhibit increased distress, especially in terms of breathing, if they have vomiting, you have unable to eat for any protracted period of time, those are signs and symptoms that you need to return to a health facility with or without a test result. So don't wait on a test result and feel that you have to be at home. If you are feeling unwell in the sense that you're getting more acutely ill, we ask that you visit your health facilities immediately and seek medical attention, notwithstanding you are waiting a result. In terms of the other illnesses related to mosquito-borne diseases, as you know, Trinidad and Tobago has an insect vector control division. So their mission is really to protect the country from vector-borne diseases, insect vector-borne diseases, of which mosquito-borne, dengue, chikungunya, Zika, and the like are part and parcel of their work. They have roughly a staff of about 800 people that are on the ground. They have never stopped working. They continue to do their perifocal work, their spraying as required. It's done throughout the year. We don't wait until the rainy season. The work of the regional corporation in collaboration with us will be to ensure that they have vector-borne units as well. So that synergy exists, that relationship exists between vector control at the ministry and the regional corporations as well as the CMOH offices. So we are keeping a very close eye and have been from the start with regards to dengue and other illnesses. Notwithstanding, the population needs to be abreast of the signs and symptoms. Again, dengue is a febrile illness, meaning that it has, at its outset, can be mistaken for any flu-like illness because you get fever, you get body pains, you get chills, you get those similar symptoms in all types of viral illnesses in the early days. So seek medical attention as early as you can. Use the hotlines as much as possible to discern what it is. Don't assume that you have COVID-19. Don't assume you have any normal viral illness. It is better to visit a healthcare practitioner, private or public, to ascertain what is happening, especially in the background of COVID, that we don't have any other illnesses that we miss, for example, dengue fever, which can be fatal as well. So we have to be cognizant of the signs and symptoms, and we continue to do the perifocal work and the spraying as required. And just want to remind the population, as it relates to mosquito-borne disease in particular, that mosquitoes really breed in small bodies of water in and around your homes. So keep your home free of mosquito breeding sites, and generally speaking, that will help abate the mosquitoes in your general vicinity. Candice?
Thank you very much, CMO. And CL Communications, we open the floor for you now for your 2 questions.
I was just wondering. Are you hearing me?
Yes, we can.
Yes,
Good
we can.
morning.
Yes, good morning. I was just wondering, with regards to the emergency services down in South Trinidad, is there enough ambulances to respond to emergency, given the fact that some information has come out in the public domain on death number 11? And then secondly, concerning the test results, people are still not satisfied with the return of the results on time. I know you've reiterated that, okay, everything is going to be done to speed it up, but how much of a speeding up is it going to be? Is it going to be like 3 days time, you're going to get a turnover? How long is it going to be?
I'll take it. Thank you so much for your question. As it relates to testing and the delay in reporting, up to last night, after 9-10 o'clock, I was there at the Trinidad and Tobago Public Health Lab with the director and members of her team. Yesterday we sent out more than 1,000 results. So yes, there was a bit of a delay, but that should pretty much be under control, hopefully by today. With regard to the provision of these tests on time, there was a meeting earlier this week where we're looking to tighten up the transmission chain between the labs and the receiving doctors, where we hope to switch to a more digital system all the way through in the next few weeks. So with those measures in place and with the backlog largely cleared, hopefully by the end of today, all the reporting that should have been done should be cleared. With that backlog, we should be hopefully back on track with regard to the reporting end of things. Testing is still expanding in capacity to meet with the growing demand, and that's something that we're taking a careful look at. We really want to ensure that we have more than enough capacity than we need moving forward. So we're moving very, very aggressively to open additional testing sites. Thus far, we have Tobago, Sandy Grande, Eric Williams, UWI, Trinidad and Tobago Public Health Lab via CARFA, and we're looking to expand that, those testing sites. I hope that answers the question.
Okay, thank you very much. And TV6, I believe that you have some questions for us.
Yes, thank you. Good morning.
Good morning.
Alicia Boucher from TV6 News. Now, we're getting information coming in that you can hear me, right?
Yes, we can.
Hello?
Yes, we're hearing you.
Yes, we're hearing you.
Ms. Boucher,
Okay.
great.
Yeah.
Thank you. We're getting information that a 50-year-old male who tested positive for COVID-19 yesterday passed through the Sandy Grande Enhanced Department of the hospital, and today the staff there has been waiting for that area to be sanitized, as well as the ambulance that was used to transport that person was not sanitized. I don't know if the Ministry of Health is aware of that, but if the Ministry is aware, can you tell us what would be done in that regard? Also, I want to find out, in terms of the contract medical staff that would be coming on to assist, would they be given the same medical benefits as permanent staff? If not, what is in place for them, should they come into contact with COVID-19 and, God forbid, succumb to the virus?
Okay, so in terms of your question related to the Sandy Grande Hospital, I will make contact with the Chief Executive Officer of the Eastern RHA right after, just to see what is happening. We'll ask him for a report on that situation. So thanks for raising it to our attention at this time. With regards to the contract, the PS of the ministry has the contract in his person at this time. I don't have the details with me of the actual contract that will be signed by the house officers and the nurses, but the alignment should be very similar to the house officer contract and the nursing contracts that are in the RHAs, but the difference being they'll be hired with the Ministry of Health so that they can be moved through the county medical officers of health. So the details, I don't have the specifics in terms of their coverage at hand at this point, but that will be with the Permanent Secretary of the Ministry of Health.
Okay, thank you, CMO. And now we will move to Newsday.
Hi, morning, Clint Chanzak of Newsday. Questions to the I'm trying to find out with regards to critical COVID-19 patients. Is there any consideration for the use of remdesivir in treating these patients? And we understand that that particular drug has some success in other jurisdictions. And secondly, knowing the amount of admissions of COVID patients to the parallel health system and the numbers which are en route, is there any challenge in terms of the admissions of these patients to the parallel system and the system on strain in any regard in this area?
Right. Okay, so the first question related to that drug, remdesivir. So as you know, that drug is part of the WHO Solidarity trial that has been used in a lot of countries. So the Ministry of Health has sent approval to the University of the West Indies to be part of that trial, the Solidarity trial. The principal investigator lies with the University of the West Indies. Just to reiterate, it is a study that uses a number of drugs. Hydroxychloroquine has been removed from that study from WHO. So it is now lies with the University of the West Indies to basically go to the patients, and they ask them for consent to utilize various drugs for treatment. Now let us be clear that this is a voluntary process. So any patient that is in any of our hospitals approached by the University of the West Indies to be part of the study can volunteer, or they can say no to being part of the trial. So it is a voluntary process, and it will be offered through the trial, the Solidarity trial, by University of the West Indies. In terms of your admission to the parallel system, yes, there is not a strain, but there is a process flow through the GMRTT ambulances that we have been using. We had a meeting with the CEOs of the RHAs just a couple of days ago to discuss using some of their ambulances to bring patients from their homes into the institutions more quickly, because the numbers are increasing. So we are hoping that in a short period of time, with the utilization of those additional ambulances, that we can lend some assistance to GMRTT, who is the ambulance provider originally charged to do this on their own.
Okay, thank you, CMO. We have limited time, so I ask for one brief question from media representatives moving forward. And we'll take a question from Guardian Media Limited.
Just before you, Guardian, just the CMOH for St. Andrews St. David has indicated that the Sandy Granny Enhanced has been sanitized, will be sanitized today. So she just sent that information across to me as well.
Okay, great. Okay. Thank you very much, CMO. And now to Guardian Media Limited, please.
Hi, morning again. CMO, is it possible that we could get an update on the legislation to make mask wearing mandatory? And also I'm seeing some research within recent days about the one-way valve masks.
Sure.
Would you be able to comment on that? They're saying that this actually could spread the virus.
So the one-way valve mask is meant to protect the wearer, not to protect other individuals. So it would not, if you are a carrier and you're wearing the one-way valve mask, you will allow the particles to go outward, so it won't protect the population or anyone else, it protects yourself. So it should not be used in general public spaces, because it doesn't afford other persons the protection that we want them to have. By way of the mask legislation, that is a matter for the Attorney General, so I can't comment on where that is at this point, but it is a matter for the Office of the Attorney General.
Thank you, CMO. Just a reminder, one brief question, please. We move to Express.
Good morning again. CMO, I would like to go back to the issue of NCDs. I think it came up last week.
Sure.
I would like to know, what are we looking at in terms of our potential, and unfortunately I'll use the word disaster. So we have a very sick population, huge number of NCDs. In conversation with a couple of pediatricians recently, a real concern was expressed about how many of our children are, for instance, pre-diabetic or pre-NCD. I know there were a lot of changes in the school system with regard to diet and soft drinks and so on, but they're also getting it in the homes, they buy it on their own. And so a real concern was expressed as to what could happen to us in terms of the sheer volume of people within our population who are already compromised. I know you ventilated the issue, but if you could give us an idea, what are we looking at? What is the level of the potential disaster we are looking at as we try to impress upon the population the importance of adhering to the guidelines? Thanks.
Yeah, so basically we have a population that has quite a large number of diabetic individuals. There are quite a large number of hypertensive persons. So again, it basically means that we have a vulnerable population. So when you add that to the vulnerable groups, tend to be persons over 60 that we have seen deaths with worldwide, people with diabetes, hypertension, cardiovascular disease, chronic obstructive pulmonary disease, asthma, and the like, which affects your respiratory system and its ability to cope. So having a higher rate of NCDs in Trinidad and Tobago just adds to the potential likelihood of morbidity and mortality being greater to the population of Trinidad and Tobago, and more the reason why we need to adhere to our public health guidelines very strictly, because once we see the majority of individuals that would have succumbed to COVID-19 in Trinidad and Tobago would have had one or more of those risk factors that we just described. So those persons are much greater risk of mortality, and we want to reduce that burden not only on the vulnerable population, but everyone must play their part to ensure that we adhere to the public health guidelines that Dr. Nandram took the time to go through in detail this morning. If we all play our part, we can protect those vulnerable groups. Even if we are part, and we saw the epidemiological shift where a younger population was affected in this phase 2. In the early part of it, we saw the age drop from 55.5 to 33 thereabouts in terms of persons being affected. And the unfortunate part of it, yes, most of those people in their 30s and 40s and 20s will recover without any major morbidity or mortality. But they are bringing that disease home to their children, to the elderly, persons with diabetes, persons with cancers, persons with SLE. And that is the risk that we are facing in Trinidad and Tobago, with that high burden of NCDs as a backdrop to COVID-19.
Thank you very much, CMO, and thank you, everyone. We have come to the end of today's media conference. Remember that we all have an important role to play in protecting Trinidad and Tobago from COVID-19.